we've come a long way in reducing the stigma surrounding mental health, we still have a long way to go. Here to share why finding a match with the right mental health professional is so important, we welcome licensed clinical psychologist Dr. Alvarado. Good to have you with us, doctor.
Thanks so much for having me.
You bet. Now, how did you come to figure this out, that finding the right match is important?
Well, it's always been something, not always, for a while been known that rapport is one of the most important parts of finding a therapist or really success with a therapist. So it only made sense that, it's such a large part of the whole therapeutic process.
Okay, so let's say if you find one, because they're hard to find right now. They're all booked up. So let's say after COVID you are just depressed. You decide to look for a psychologist. What are you saying we should look for in a psychologist?
Yeah, so there's a few things that you definitely want to look for. One, you want to make sure that the person's specialties are something that you're also seeking help for. Number two, you should probably look for evidence-based treatment. So there's a lot of different modalities and specialties and types of therapy therapists use, and you want to make sure that they're all backed by science. The other thing you want to find out is you want to have a conversation with the therapist, because you want to be comfortable with this person. You want to be able to feel like you can speak with this person on very personal issues. So that conversation is a really important part of that matchmaking process.
Do you think if, let's say you're a woman, you should probably find a female psychologist and a man, a male psychologist?
Not necessarily true. That's true for some people, but it can be very therapeutic for some people who might have had experience or poor experiences with someone of the opposite sex. So it really depends person to person. There's really no set standard for any type of gender.
Do psychologists go through, can you meet with the person first, do like a consulting session to find out if you're going to work?
They should. Most do, not all, but they should. And I highly recommend anyone seeking a therapist to have that conversation. Usually just asking for a free 15-minute consult is enough to warrant one. And it's good for the therapist and also the client and the therapist, right? The client, so they know if the therapist is a good fit, but also for the therapist to know if the client is a good fit for their practice. And it should be something that's important to both the therapist and the client.
What are some do's and don'ts then in that consultation?
Yeah, great question. And first and foremost, to understand that it is a consultation and it's not a therapy session. So it's usually only around 15 minutes. And you want to find out a few things about the therapist. One, has this therapist helped people similar to me? Also, if that person has, an idea of what therapy might look like with them, they should have an elevator pitch. And similar with you, tell them your elevator pitch of why you're coming in to session. And lastly, find out what type of therapies they use. This is something, you might not understand what they're saying, but it's something to Google and find out if there's a lot of evidence that supports their modalities.
Have you heard some horror stories of people who've gone to a psychologist and it didn't work out at all?
Unfortunately, yes, I have. It's definitely a common story. And it's unfortunate because a lot of people have those experiences and they generalize it to all therapy and then never seek a therapist again. So this is why it's so important to really, to get it right the first time.
Yeah, the first time means everything.
Right. Yeah. So, if we can really help, create a great experience or a helpful experience for people when they first seek therapy, I think it could really help the stigma surrounding mental health as a whole.
You mentioned different modalities. There are quite a few out there. What are some that you say aren't backed by science?
So some of the big ones that you hear are CBT, cognitive behavioral therapy, ACT, acceptance equipment therapy, DBT. This is just, I know these are going to sound like just random letters, but yes. So do research. I would say whatever they tell you, I would say do some research, and it's a quick Google search. You'll be able to find out a lot.
Oh my gosh. So tell me about is there a time that therapists decide that the patient isn't right for them? Do you guys get to decide that as well?
Yeah, yes. It's only ethical that if a therapist feels like they're not the best fit for somebody,
right,
or if they know someone who might be better fit for them, that they let the client know that.
And if you've got a teenager needing some help, which a lot of teenagers need help right now, who would you suggest? What to look for with a teenager?
Well, just similar, like I mentioned before, making sure that that therapist has experience, with adolescents or children.
Right.
And just as a parent, if a parent asking for a child, what that therapy process would look like.
All right. Great information, Doctor. We'll put all the information on our website. And thank you so much. Appreciate it.
Thanks so much for having me.
You bet.